This is my student support system. Keep watching, keep learning.
Hello, welcome to my student support system. In today's class, we will discuss about cancer. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Or you can directly visit to channel my student support system. Let us discuss what is cancer. Cancer is a condition in which some of the body cells grow uncontrollably. Means our body doesn't have control on that multiplication. It is in other words, we can say there is uncontrolled multiplication of cells, and these cells spread to other parts of the body as well. Most cancers occur in the people older than 65 years of age, and the incidence of cancer is higher in men than in women. Cancer can start almost anywhere in the human body, and as you know, in our human body we have trillions of cells, and at any level, at any site, cancer may start. Let us discuss now what is cancer symbol. Actually, cancer ribbons are there which shows awareness about a particular type of cancer, and these loops are also worn on the body to show the unity with the cancer patients and to spread awareness. There are 43 different colors, such as pink is for breast cancer and orange is for leukemia. Here you can see there are a lot of ribbons. Few of them are like this. It is for pancreatic cancer. This ribbon is for brain cancer. This is for lymphoma and so on. So these are to show awareness about the cancer. Now, what is cancer? What happens to the cells during cancer? Means, what is the pathophysiology? The disease process in cancer begins when an abnormal cell, which is transformed by the genetic mutation of the normal cellular DNA. This abnormal cell forms a clone and begins to proliferate abnormally. These cells are known as malignant cells or cancer cells. What are the characteristics of malignant cells? Actually, cancer cells share some common cellular characteristics related to the cell membrane, special proteins on cell membrane, the nuclei, chromosomal abnormalities, and the rate of mitosis and growth. The cell membranes are altered in the cancer cells, which affect fluid movement in and out of the cell. The cell membrane of malignant cell also have a protein known as tumor-specific antigen. For example, carcinoembryonic antigen and prostate-specific antigen (PSA), which develop over time as the cells become less differentiated. These proteins distinguish the malignant cells from the benign or normal cell of the same tissue type. Malignant cellular membrane also contain less fibronectin, a cellular cement by which they are attached to each other. Therefore, they are less cohesive, less attached to each other, and they do not adhere to the adjacent cells, and easily they detach from the cell and metastasize. Nuclei of cancer cells are large as compared to the normal cells and irregularly shaped. Nucleoli are again larger and more numerous in the malignant cells, and there are chromosomal abnormalities as well as fragility of the chromosomes in malignant cells. Then cell division is also different. Cell division in malignant cells are more frequently or more rapid. Due to this, the swelling can be seen over the cancer cell. Tumor is formed due to abnormal number of the cells. As cells grow and divide, more glucose and oxygen is needed. But if the glucose and oxygen are unavailable, even then the cancer cells use anaerobic metabolism and produce energy for the growth and multiplication. Now we come to invasion and metastasis. What is invasion and metastasis? These are two processes by which the cancer grows or spreads to the other parts of body. Cancer have the ability to spread by invasion and metastasis. What is invasion? Invasion means the growth of primary tumor into the surrounding host cells. Means the adjacent structures are also affected and tumor spreads to the adjacent structures. Malignant cells are less adherent to each other, so they easily break off and move to the other part of the body and settle there, and cancer growth starts on the other part of the body. Metastasis is a system or process by which the malignant cell move from one place to another or distant site via bloodstream or lymphatic stream and spread to the far away site of the uh, tumors and into multiple organs. So this spread is known as metastasis. What leads to cancer? Means what are the causes? Actually, cancer is a multifactorial disease. Means a lot of factors are there which can cause cancer, such as virus and bacteria, physical agents, chemical agents, genetic or familial factors, dietary factors, and hormonal factors. Now we will discuss them one by one. First is virus and bacteria. Viruses are thought to be incorporate themselves in the genetic structure of cells, leading to cancer. For example, Epstein-Barr virus is highly suspect as a cause in the Burkitt lymphoma, nasopharyngeal cancer, and some other types of non-Hodgkin and Hodgkin lymphoma. Some bacteria may also cause cancer. Helicobacter pylori or H. pylori was the first bacterium to be termed as a definite cause of cancers in humans. H. pylori has been associated with the increased incidence of gastric malignancy related to the chronic superficial gastritis. Now we come to physical factors. Physical factors are associated with carcinogenesis, includes exposure to sunlight or radiation, chronic irritation and inflammation, especially with the tobacco use. Excessive exposure to ultraviolet rays of the sun, exposure to ionizing radiation can occur with the repeated diagnostic X-ray procedures and exposure to radioactive material at the nuclear weapon manufacturing sites. Or nuclear power plants are associated with the higher incidence of leukemias, multiple myelomas, and cancers of the lung, bone, breast, thyroid, and other tissues. Now chemical factors. Exposure to some hazardous chemicals produce their toxic effects by altering the DNA structure of the body and This may occur to the distant site of chemical exposure. The liver, lungs, kidneys are the main organs which are affected by chemical factors and lead to cancer. Tobacco, including more than 60 other chemicals, there is a vast list of chemicals. They are also carcinogens. Tobacco may also act with the other chemical substances such as alcohol, asbestos, and uranium to produce or to promote cancer development. The extensive list of the suspected chemical substances continue to grow and includes aromatic amines, aniline dyes, pesticides, formaldehyde, arsenic, soot and tars, asbestos, benzene, betel nut, lime, cadmium, chromium compounds, nickel, and zinc ores, even wood dust, beryllium compounds, and polyvinyl chloride. Genetic and family factors. Genetic factors also play a role in the cancer cell development. Specific cancers with underlying genetic abnormalities include Burkitt lymphoma, chronic myelogenous leukemia, mangiomas, acute leukemia, retinoblastomas, Wilms tumor, skin cancers including malignant melanoma. Now dietary factors. Dietary factors to increase the risk of cancer includes fat, alcohol, salt cure or smoked meat, nitrate containing foods, and red and processed meat. Alcohol increases the risk of cancer of the mouth, pharynx, larynx, esophagus, liver, colorectum, and breast. Hormonal factors. Cancers of the breast, prostate, uterus are thought to depend upon the endogenous hormone levels for growth. And DES, diethylstilbestrol, has the long been recognized as a causative factor of vaginal carcinomas. Oral contraceptives and prolonged estrogen therapy are also associated with an increased incidence of hepatocellular, endometrial, and breast cancers. Hormonal changes related to the female reproductive cycle are also associated with the cancer incidence. Early onset of menses means under age of 12 and delayed onset of menopause after 55 and nulliparity means never giving to birth and delayed childbirth are also associated with the increased risk of breast cancer. So these are the causative factors of cancer. Now investigations and management. Actually investigation and management will be different for different type of cancers and we will discuss them in upcoming lectures when we will study particular type of cancer like breast cancer, skin cancer, blood cancer, etc. Thank you for watching this video. You can subscribe the channel for latest updates and you can visit blog for making your notes. You can uh, follow me on Twitter, Instagram and join Facebook group Nursing Notes. Thank you. Have a nice day.